I'm Adrianna Quintero, and I'm very excited to be here. I wanted to say thank you to the Vola Foundation, thank you Thais, thank you David, and thank you Abby for organizing this wonderful conference. It's really important that we're all here in Florida. We just need to look to our north to see what the urgency is around what's facing us. And unfortunately, not only do health impacts from climate change and the warming planet affect us all, but when we have storms like this, the health impacts and the economic impacts are only beginning. Mold and breathing difficulties from that, of course, even injuries from debris, even mental health costs that are, when we look at some of those factors, it really is just this amazing slew of health and economic impacts. Of course, places like Destin and Panama City that rely almost, to a huge extent on tourism dollars are looking at what could be a very, very tight economic future. So I'm really excited to be here today with this panel, and we're going to get rolling so that we get through everyone's talk. And I will start that off with, actually, I'm going to start with you, Sam, and I don't know if this is going to mess up the slides, but I'd love to start with, will it, Abby? Should we go? Are we okay?
Yeah,
okay,
I didn't
wonderful.
bring slides.
Great.
Not for this one.
I'd like to start with you, Professor, because you're here at the university, and I'd love for you to tell us a little bit about your work here and what you see as some of the biggest health challenges due to climate change, and also health disparities, because I think one of the things that we've also heard today and that we know is that it does not affect everybody equally. So if you wouldn't mind leading with that, we'd love to hear from you.
Okay, thank you so much for the introduction. I'm Sam Park. I teach environmental sociology. It's called Environment and Society, and it was good to meet two students at this conference from my class. I teach environmental sociology and medical sociology and some other health-related courses. So that's my research area as well. And I'm going to introduce you to a study that, by the way, some years ago I was interested in studying how Congress, especially congressional committees, debated climate change some years ago. And then we tried to represent the connections between committees and different climate issues, depending on who controlled the chambers in Congress. So it was very, very interesting. It was not related to health, but that was my original interest. And then I became more interested in climate change and its health impacts. So I'm going to talk a little bit about a study that I use in my class, Environment and Society, about the health impacts of climate change. There's a famous German sociologist, Ulrich Beck. I hope I pronounced the name correctly, Ulrich Beck, German sociologist. Some time ago, he said that poverty is hierarchical, while smoke is democratic. I understand that poverty is hierarchical. That means, yes, we are different in terms of what we have, right? Socioeconomically, we are different, so it's hierarchical. But it says smoke is democratic. That means, I think he meant that we are all exposed to smoke equally, right? Pollution equally. And we also contribute to pollution. Maybe not equally, but basically we contribute to pollution. But many people do not agree on that statement because we are different in terms of experiencing the health impacts of environmental issues. So we are different a little bit. So the question is, what are the ways in which pollution, greenhouse gases, and climate change affect health, and especially health disparities among categories of people? And also, what are the implications for health? What do we need to do to reduce the gap between categories of people in terms of health impacts? So there are two studies, but I'm going to talk about the first one only right now. Some time ago in 1995, Chicago experienced the extreme heat wave in 1995. So it's like about 20 years ago. And not many people still don't know what happened at that time. But a study was reporting that case in 2002. The question was how climate change has made the extreme weather events in urban centers a major challenge for cities. If you know Chicago, it's not very warm, right? It's not very hot. But in July 1995, the temperature was 106, and the heat index was 126. And not all houses had AC at the time. So over a week period, over a 1 week period, more than 700 people died in Chicago, in a particular area in Chicago, in suburban area. So he wanted to, the author wanted to understand what was the scale, how many people died, and what was the scale of deaths related to heat wave. This is relevant to climate change because it doesn't belong to my expertise, my area, but many people associate climate change and extreme weather events such as heat wave, drought, storms, etc. A lot of them were elderly people. 73% of the deaths were over 65 in terms of age. In terms of gender, males were twice as likely to die as females. In terms of race, more African Americans died than non-Hispanic whites. And the manner of deaths, many people died at home alone behind locked doors and sealed windows. And the author wanted to understand why so many people died at home alone in Chicago. So he wanted to find out the sources of vulnerability. And the answer was social breakdown, because he observed there were two different areas that he observed, and the northern area and the southern area. The northern area is called North Lawndale and South Lawndale. In the northern area, lots of people were isolated from others. So there were not many social contacts. And in terms of business, there were not many things going on in that area. So people, and it wasn't safe to go out and then ask for help. So lots of people died alone. So social isolation was a very important factor that explained lots of deaths in the northern area. And the city government and the state just abandoned that area because it was such an area. And there were not many available public assistance programs for those people. So, so that's the first study that I want to use to explain health outcomes. Health outcomes can be really different depending on who we are, where we live, and the manners of the ways in which we are affected by climate change and extreme weather events. They can be extremely different depending on where we live, who we are in terms of socioeconomic, social demography, and also where we live and how society is organized. So for example, social fabric is really important. We need to be connected to others. We need to support each other to minimize the worst consequences of climate change and other extreme weather events. So I want to talk about that first. Yeah, thanks so much.
Can I ask one quick follow-up question before we move to the next speaker? Obviously, social breakdown and who we are, where we live, you're pointing at that as one of the really important things. Was something like, and I think you alluded to this, but just to clarify, like insecurity in the neighborhood also something that you found? And in your further follow-up work, have you found that these health impacts have relevance? You reference your work with congressional leaders. How has that been received, that information on health impacts? Is that something that is important to decision makers?
Oh, sure, yeah. But if you believe in capitalism, you believe that people will live, it is good that people just take responsibility for their health, what they do, right? So I think it depends on where the decision makers are. if they believe government needs to intervene in society and try to help those who are in need. Yeah, yeah. Less or unfortunate individuals, then they will try to do certain things. But I think we are extremely divided right now. So people have different ideologies, and depending on the ideologies, people try to allocate resources differently. So I think people understand what's going on, but they are not trying to help others. So there's a huge gap. There are gaps between social groups in terms of the outcomes. And when we try to close the gaps, so suppose we have just two different groups and there's a large gap between the two, and we cannot bring those who are better off down, right? We just need to help others at the bottom of society. Then, because they are in need, they need certain things from society. So, but we are different in terms of understanding their needs.
That's very helpful. I know that in my research, we found definitely that communities of color do suffer greater impacts from climate change, whether it be in urban centers or in rural communities, such as farm workers who are predominantly Latino, or Asian Americans who are not well integrated into society for whatever reason, whether it's a socioeconomic issue. So clearly, it's something that is extremely impactful, and of course, where we live depends on how exposed we are to different types of pollution. Shifting gears a little bit, I'd like to move to you, Andy. Because I think that all these impacts, as we're talking about, we need to solve them in ways, clearly, as Professor Park said, that appeal to legislators and that fit within our systems. As much as some of us are hoping to change our systems, we for the foreseeable future will be living in a very in the same types of systems that are focused on trying to allow people to become self-sufficient. Would you tell us a little bit about your work in the climate finance space and addressing some of these health issues using these types of solutions?
Sure. Do I have a clicker?
Yes, you do, right here.
Presentation, I think. It's the Bolo, the one that from this morning? The one from this morning? Yeah, I just got to fast forward. I have to get it.
Sure, well, we can...
Yeah, I can just sort of describe what, so, I mean, one of the big things with climate today, obviously, because of the political situation, it's much more difficult to talk about climate change and the impacts, even though they are in your face or, you know, hurling down the state of Georgia at the moment. No, not that one, the one from me, sorry, Andy Stevenson. And talk about pollution and the impacts of pollution. If you think about China and India, you see pictures on TV of people with masks on constantly, and the actual health impacts. I mean, just for example, and oh, good. I got to go zoom through this real quick. Sorry. It's a treat this morning. Could have given you more slides. Sorry. Okay, there we go. You know, you look at China, for example, there's estimates that the air pollution is going to reduce the lifespan of young Chinese, you know, babies by up to 11 years because of air pollution, right? You're talking about a meaningful, I refer to it as sort of airborne diabetes, you know, that you are actually giving these poor, you know, children that don't have obviously any choice in the matter a very, very unfair start in life, because you're talking about a meaningful amount of their lives, which type 2 diabetes is sort of a 14 to 17 year shortening of a lifespan, but it happens and it begins much earlier when you talk about air pollution. So just to illustrate what has happened in the United States with respect to air pollution and why pollution is a very good way of framing the discussion, I just wanted to give a very quick, it is very short presentation on what the Clean Air Act did and the health impacts, which are just staggering, and the economic impacts, which are even probably more staggering for lots of people. So just to give a real quick overview, we had two bits of legislation with respect to the Clean Air Act. The first one in 1970, which focused on lead and all the kind of NOx and SOx and particle matter, a lot of the pollutions that cause respiratory failure and things like that in the United States. The second piece basically just doubled down on reducing emissions from, again, NOx and SOx and a lot of the air pollutants that come out of the combustion of fossil fuels. So this is very much related to fossil fuels. Fossil fuels, generally speaking, have been in the ground for a very long time, but there's a lot of impurities in it. When you burn them, a lot of it, the gunk goes into the air. In terms of the costs of the two programs, roughly for the industry is about a $40 billion proposition, kind of on average over the course of this entire 50-year period. The benefits, however, were just absolutely staggering from a healthcare perspective. You're talking about between $1.3 and $1.5 trillion a year in healthcare benefits. Those benefits can be broken down here. You can see, maybe you can't read that far. I know I can't. In terms of lost IQ points, respiratory failure, hospital visits, lost work days, obviously early death, a number of things that added up to a very large number in terms of the monetary costs. For example, chronic bronchitis is sort of a $400,000 healthcare bill over the life of that person. Obviously, death is a very high expense as well. But just in terms of, I should have gone back to this one. Back one. Okay, that's on the right is the number of lives saved from the first Clean Air Act. And you can see that the numbers on average rose pretty significantly over the period. I just want to move to the next one where I kind of put them both together, which is the combined benefit of the Clean Air Act 1 and Clean Air Act 2, talking about 450,000 lives saved, according to the EPA estimates, when they did their economic benefits of the Clean Air Act over the course, in the final year of the Clean Air Act, which would be 2020, is the end of the analysis. So just to give you a sense of what that really means, you're talking about 10 million lives saved over the course of that period. That's a significant number of American lives. Over 50 million asthma attacks avoided and 1 billion lost work days saved. From an economic perspective, that total value of that of all those healthcare benefits is about $62 trillion, and that works out to almost 18% of GDP. So a way of thinking about it is if we kept things as they were, the GDP of the country would have been significantly lower than we were able to grow at because we weren't, dropping out of work because of healthcare impacts related to pollutants associated with, fossil fuels.
Well, that's incredible and really staggering. And I think what it makes clear is that this dichotomy between protecting our health and protecting the economy is really a false dichotomy, right? We have to protect our health if we want to protect our economies. And doing so is actually going to make us money rather than cost us money. And when we're looking at the challenges of funding healthcare and the continuous threats that we have to our healthcare system, especially again for lower income individuals and elderly Americans, it's clear that we can't separate our health from our environmental health.
That and the return on those investments was just staggering. 35 times return on anything is pretty phenomenal year in, year out over 40 years.
Wow.
Almost 50 years. So it's, it's very impressive.
Why do you suspect, I mean, I somewhat answer my own question in my head, but why do you suspect there's such a resistance to really recognizing the benefits of these types of health protections?
Well, it's sort of avoided costs, so it's harder to, what happened over the last 50 years I happen to be 50 years old, but you don't know what could have happened over that 50-year period. So if you can, as I described this morning, you couldn't see across the street in New York City, garbage was going down the river, the East River. It was a pretty, people died quite early. And if you look at what people died of in those days, it was pulmonary diseases basically related to bad air, right? And so we don't really appreciate how far we've come and at sort of what little cost to us as, our electricity prices aren't through the roof. People just threw scrubbers on these things. Like there are fixes that actually increase employment.
My last question to you, Andy, because this is one that I always struggle with. oftentimes we come across people who will say, well, you're talking about air pollution here. We're not talking about climate change. What do you say to that?
Sure. Well, I mean, in this case, the perpetrator happens to be the same person, so and it's the same in China, it's the same in India. It's bad air from, burning coal primarily. That's the dirtiest, but there's a lot of things that we make that are not particularly nice in terms of what the outputs are to the air. So, and they're generated mainly from the impurities of hydrocarbons.
Fossil fuels.
Yeah, I mean, there's mercury, and the mercury is in there because it's very old, and so is the plant life that created the hydrocarbon.
Wonderful, great answer. So all of these things are frightening, but places like Orlando have actually taken the lead to find solutions. And Chris, I know you've spent a lot of your time, a lot of your life working on these issues, and I'd love for you to tell us a little bit about that, about your experience actually coming up with practical day-to-day solutions and dealing with some of these same issues in the community.
Sure. Well, as I mentioned earlier on our panel, I really took a lot of inspiration from Gina McCarthy at the Boston Climate Summit when she was trying to change the focus of a lot of elected officials. That climate summit was very focused right before the U.S. Conference of Mayors. There was a number of mayors that were there, and she tried to pivot the focus away from the planet per se and more towards public health and well-being. And I think that type of message really did resonate not only with Mayor Dyer, but with many other mayors in the audience, and it's particularly why I feel we're going to see an urgency to act upon this, hopefully here now. It's obviously, after what we've been talking about here, is fossil fuels are fouling our atmosphere, and we are doing it without any price on that externality. And without that included into the equation, it's very difficult for us to actually make the economic transformation that I think we need rapidly. Many of us know the health impacts that fossil fuels can have, whether they're through the tailpipe or at the smokestack. Increasing asthma events, increase in pulmonary diseases, chronic bronchitis, premature deaths. There's actually a study that came out by Yale University that showed that last year 7 million people died because of air pollution. So we're talking about real deaths. We're talking about real deaths here. The other thing that caught me about the economic impact of this stuff is that at the Global Climate Action Summit, they were talking about the expansion of the developing country and how these countries are going to power themselves. And they said that for every dollar we invest in fossil fuel infrastructure, $10 are going to be paid over the lifetime of those assets as it relates to public health and environmental concerns. A 10-to-1 ratio of this investment. That is being hidden, of course, because, again, we're not valuing that externality. It's not being put into the economic equation, and therefore we're completely leaving it out of the system. So, as you mentioned, my role over the last 5 years in Orlando has been trying to figure out what can cities do with our leadership around policy or programs to spur a market that completely transforms our investments away from the energy that built the world, as I mentioned, the 18th century technologies, to those that will shape Orlando and the future cities of the world. And so, we've broke that down. We're a big contributor to CDP, the Carbon Disclosure Project. We're constantly tracking our air pollution and greenhouse gas emissions. What we've found is that because of our grid and the makeup of our grid being still about 40% coal, another 45 to 50% natural gas, and a rapidly growing percentage of renewables, we're starting to see that our buildings and the built environment are the biggest contributor to our problem. 80% of Orlando's carbon footprint is associated with the built environment, with buildings using dirty electricity at the end of the day. 20% is associated with our transportation sector. So our thought process here is, one, how do we spur the reduction of the energy demands that we have in the built environment, and then how do we spur the transformation of the supply side? And so a lot of those, and I kind of quickly ran through them earlier, but first and foremost, Orlando a year and a half ago was the first city in Florida to pass a mandatory building benchmarking, energy audits, and transparency policy. This is a requirement that every building above 50,000 square feet in the private sector and 10,000 square feet in the public sector begins to go through an annual process of measuring their impact from an energy and water standpoint, and then making that information transparent, almost like a miles per gallon on a vehicle in every car lot you go to, or nutritional facts on food products when you go to a grocery store. Now when I go to rent an apartment in downtown, I can actually see the full cost to own or lease that space, not just the cost of rent, but how much am I going to spend in utilities? And what that does is it actually creates a cycle of improvement, a market driver for the building owners and managers to figure out, how do I go from a 20 out of 100 to a 75 or above in terms of my energy performance? That would attract more tenants to my building because they want to live in a place that's healthier and lower cost, and it creates an entire driver for the economic system behind energy efficiency, from the supply side of the lighting, controls, HVAC, envelope, windows, you name it, all the way down to the auditors, to the installers, et cetera. So energy efficiency has been a big push. And then usually the question becomes, okay, I'm a 20 out of 100. I know I need to do X, Y, and Z because of my energy audit. How do I pay for it? And that's where we thought that bringing in PACE and other finance tools, we actually have an on-bill financing program for energy efficiency in the residential side through the utility. But the idea is we need to enable capital to offset the upfront investments and find creative ways to repay those that have cash flow positive implications, something that's immediately a net gain for somebody to make an investment. We had a small business who took out $10,000 last year to make small improvements, lighting, they put some controls, they did a small HVAC improvement. They're now saving $100 per month on that, on their utility bill. That over 12 months is $1,200. Well, they took their PACE assessment and they basically stretched it over an 8-year period. And with interest on the money, they're paying about $1,000 per year, but they're saving $1,200 per year from day one without spending any of their own capital. So you create these no-brainer economic solutions to drive energy efficiency. And the truth of the matter is, energy efficiency is the most cost-effective and most impactful way for us to begin to reduce pollution and mitigate carbon. So that's on the demand side. And then the supply side becomes some of the things we're doing around driving and accelerating clean energy adoption. We have streamlined permitting processes. We're a Soul Smart Gold city in Orlando. We have waived small-scale permit fees. We're in the process of moving in that direction. We've trained auditors and inspectors for the soft cost side of things, because people usually leave that out of the equation, and that's things that cities can control. We've also created these programs like community solar and solar aggregation, which allows us to make it more affordable or easier to tap into a clean energy alternative. So the idea is we have to think creatively about policy and programs at a city level, and then the hope is we start to replicate with some of my peers. And then the last thing I'll say is we don't want to leave out transportation, because it is a growing part. We just found out globally that transportation makes up more now than the built environment. We have more vehicles on the road. That's obviously locally dependent, right? But for Orlando, we are trying to rapidly accelerate EV adoption and also multimodal transportation options. We have now the Sunrail, the commuter train, that's been a tremendous addition to our community. We have a bus rapid transit system that's now in the process of electrifying. By 2025, we will have full-scale electric buses within downtown Orlando. Our city fleet went from 1 EV when I first got there to now over 100 EVs in our city's fleet, and a goal of, by 2030, 100% alternative fueled vehicles in Orlando. And we're also the top 5 EV-ready cities per capita in terms of the chargers that are available. We have nearly 400 public available EV chargers in Orlando, making us ripe and ready for this transformation. And I just sat down with Tesla a couple days ago, and the numbers on the reservations for Model 3 are going to blow the numbers out of the water. We went from 1,700 EVs in May of this year to now over 3,500 EVs now, as the recent number I pulled. So almost doubled in a matter of 6 months, and we're on track to probably quadruple that by this time next year. The EV rise in Orlando is happening quickly, so it's a matter of transit as well as making sure we're prepared for that adoption.
Well, that's really incredible, and congratulations to Orlando and to you and to Mayor Dyer for the work that you've all been leading. How have you dealt with the issue? Because I think some of the challenges that we find with these types of programs continues to be, how do we make sure that low-income residents are not left out, especially the renters, for example, where the savings may not be passed on to them. They may not have the luxury of really picking a climate-smart building, so to speak.
Sure.
How has Orlando dealt with the equity issue?
It's a growing importance within our city. In fact, our recent plan that I just launched, climate resilience and social equity, are the themes that are woven throughout all of the pillars of our plan. And if we're just talking about kind of the climate component, I go back to energy efficiency. We have this program called Efficiency Delivered, and the whole point is to work with renters and owners, whoever owns them, to essentially offset the upfront cost to make some of the weatherization and efficiency improvements. And then based on income, it's an income-based program, we subsidize a significant amount of that. So this is a free energy assessment. You literally call up OUC in a matter of a month, we'll come out, provide an assessment, and then upwards of $2,000 of improvements to, that are tacked onto the bill, paid over a 2-year period. And if you make less than the $30,000 per year poverty rate, or sorry, 40,000 per year poverty rate, you are subsidized 85% of that. So you pay $300 of the 2,000 back through the bill incrementally, and if you're under 60,000, you get half of it covered. So we pay 50, and you pay 50%. You pay $1,000. So that's one strategy. The second one is we've partnered with a nonprofit called Solar and Energy Loan Fund. They were originally out of the Treasure Coast and St. Lucie County. And Doug Coward, the executive director, created this amazing model of turning a nonprofit into a CDFI, a Community Development Finance Institution. The beauty about CDFIs is you're certified by the Department of Treasury to get very low interest capital from large financial institutions. You can get Community Reinvestment Act funding, less than 2%, sometimes less than 1% capital. And then what they normally do is CDFIs normally build affordable housing. So they'll take a low interest capital, they'll build housing, they'll keep rents low. Doug thought, well, instead of building housing, we should provide loans, mark it up a little bit, and provide loans specifically targeting low and moderate income census tracts. They have to give 70% of their money, 70% of their money to LMI census, and give it to them for energy efficiency improvements. Have them take the savings, pay back the loan through the savings, and really target people who have as low as a 500 credit score, people who may have a bad credit score because of health issues that their family might have burdened or they themselves might have got into. And so SELF really handholds them. We were fortunate that in 2015, I was able to fund their operations to come to Orlando. We've done millions of dollars of improvements to low-income communities and targeting people of color and Hispanic communities in Orlando. And I think that we need to just work on scaling that more.
That's incredible. That's fabulous because it's really building that wealth back into the community as well. So thank you so much and congratulations for all of that great work. This has been an excellent panel. I think we have a little more time, Abby, right? Great.
Cool.
Yes, please, Thais.
Okay. Replicate. Yeah. Yeah, I mean, so I'll talk about the story of passing the benchmarking and transparency policy, which we certainly could not have done without a community of advocates and associations, and USGBC in the room here I want to recognize was a big part of helping us to do that. But I will say that we had a tremendous amount of opposition. Of course, as a building owner who has an established building that we gave them the approval to occupy, and then coming back and requiring them to provide information, there was a lot of pushback. There was a lot of lobbying that went against us, behind my back to commissioners. It got really dirty. But at the end of the day, we did a third-party economic and health impact study. And that really helped paint the picture that we could save upwards of $200 to $300 million over the course of the next 10 years, just through enabling information transparency to the market, because we knew its cycled improvements. In addition, upwards of 500 to 600 new jobs, potentially 2 billion kilowatt hours saved, $64 million in healthcare abatement or savings of healthcare costs that we may have on the community. And so when you start to paint the picture around this being less of a climate problem and more of a public health issue, that's where we were able to get our commissioners to truly understand the importance of enabling a requirement like this, right? On the renewable side, we've seen less opposition and surprisingly corporations standing up and making major commitments. You have companies like Darden, who's headquartered here, nearly fully solared, on their facility. You have IKEA, who's here, other smaller businesses that are beginning to incorporate renewables. And what we've been trying to do is, again, dismantle the barriers. How do we provide financing? How do we provide a community solar program to easily sign up, an aggregation program to lower the cost if you want to make an investment, and make it easier for them through our permitting and inspection process, streamline that so it's quicker and it's less money. I think at the end of the day, changing the conversation again from climate and animals and the planet and more towards ourselves is going to resonate more with elected officials, and it's shown to be, a positive trajectory in Orlando. Hopefully others can replicate, right? I want to quickly also mention that South Florida has, for 7 or 8 years now, has had the Regional Climate Compact. And I think that that is a very powerful strategy to bring together counties and cities within there to have this important dialogue. Tampa Bay, earlier this week, I think on Monday, officially signed up with starting their Tampa Bay Regional Resiliency Collaborative. And 2 or 3 weeks ago, thanks to the good work of Jennifer Rupert over here at East Central Florida Regional Planning Council, we were able to get the commission in Central Florida to approve of the development of a framework to create the Central Florida Resiliency Collaborative and start to get 7 counties in Central Florida to start sharing best practices like what Orlando is doing and replicate them out across the region. And this is a major step forward, right? We need to start getting these regional planning councils to help us organize and replicate those efforts. So.
That's amazing, and it just highlights the fact that even now, when things seem to be at a standstill in the federal government, there's so much that can be done at the local level.
Yeah.
Yes, you have a question.
Called which? Griffin Park. It's affordable housing. Yeah. Yeah, I will say that that was poorly planned. And I think that that's a particular neighborhood in Orlando that the Paramore, Callahan, Holden Heights, Griffin Park, that area is predominantly African American. It's a very low income part of town, and it shows the disproportionate impacts that I think we have on communities of color and those who are less fortunate. There is a lot happening right now with the ultimate I-4 to completely, in fact, that interchange that you were talking about that goes from I-4 to 408, which surrounds that neighborhood, is completely going away. It's going to be turned into a public park. And a lot of the development that you're seeing of the higher kind of off-ramps and on-ramps from each one of those highways is going to allow us to have kind of less of that pollution being circulated at the lower, at the ground level, right? You have these highways are primarily pretty low. That whole housing, the Orlando Housing Authority owns that. That whole development is actually going to be refreshed and renewed. And so there's a lot of work that's being done, and this is really an FDOT thing. It was nothing the city of Orlando could even do because it's a federal interstate, and we didn't necessarily have an opportunity of choosing where it was going to go, per se. It was going to go somewhere in this general vicinity. I do think that we need to address it. We are committing to developing a network of air quality sensors throughout the city of Orlando. It's in our new Greenworks plan. The idea is we have to measure before we begin to manage that appropriately. We're not measuring anything. So we now are going to work with OUC to outfit our streetlights to have air quality and environmental monitoring, and have a network of these so that we begin to really pinpoint as to where are the hot spots of pollution, and then begin to address those, right? So that is one major step forward. And then secondly, we need to figure out more creative ways to get people off of those highways at the end of the day. And I think, more expansion of Sunrail, the electrification of the buses that also create a lot of that low-level pollution, I think is going to help. And we're open to other strategies as well.
Well, you mentioned that this is a federal project, and one of the key things that's in the mark of the current administration are the fuel efficiency standards, right? Wanting to get rid of the hard-fought and hard-earned fuel efficiency standards, which guarantee, that our cars use less gas, and eliminating those will set us back in time and create even more pollution for neighborhoods. Because hearing you speak, I can think of so many communities around the country that are in that same situation and suffering greatly and really stuck, as you said. So I think that's really innovative and another really great step for that. How are we going to pay for some of these things, Andy? Because obviously these are big investments.
Sure. I mean, a lot of the things, for example, reducing the sulfur content of gasoline and things like that can do a lot of wonders without actually being very expensive. So, I mean, some things are sort of slightly technical rather than being huge infrastructure lifts. And especially with respect to, scrubbers and things like that, they actually create a lot of jobs. So those are actually quite positive. If you look at, coal plant or any of these kind of smaller, they're all very, 25 people maybe work there, but you take 600 people to put the scrubber in over 2 years. So it's it's $100 million worth of investment. So the economics in terms of jobs and investment, I mean, there just isn't a lot of, the thing about the built infrastructure is that it was built a long time ago, so it's all kind of due for a refresh, right? So it's hard to argue that over time these things aren't going to either shut down on their own or just, there's always going to be a better solution when you talk about what this was like high tech in 1974, so these things are all run a very, very short life when you look at things, like the pickup in laptop computers or desktop computers happen so quickly.
Yeah, that's what I say. I say, the minute that you're ready to, not wanting to give up coal is like saying, you know what, I don't want this iPhone. I'm going to take, not even the rotary phone, I'm going to take what I had in 1925, just that little cone like, hello, and having the operator connect me, because that's the equivalent, and none of us would want that.
Well, I want to quickly just also add on to the importance of public-private partnerships. I think that they're a strategy that often gets left out, and for us, as an example, we're looking at using the savings of the lighting retrofits from high-pressure sodium and metal halides to LED to cover the cost of some of these additional sensors like the air quality monitoring, right? So there are some creative ways to use savings to repay for other things that may or may not have a revenue stream. The other thing is coupling them with things that do have a revenue stream. A lot of our phones are causing us to move towards 5G, 5th generation for wireless. That technology has a much shorter bandwidth, so you need more of these, what they call distributed antenna systems or DAS systems, to allow for a reliable connectivity, and it's much faster. So using telecom in these poles, in the light poles, they're calling them smart street lights now, telecom can pay for a lot of the additional improvements that we want to add, these sensors, and they will rent these poles to allow for their system to be reliable and full connectivity. So we're looking at P3 opportunities where they make the investment, we identify savings, and pay for some of these additional things that will allow us to better target where the problem is.
That's excellent. I don't want to miss that question. Are we at time?
We are. We'll take one more very quick question.
Okay, great. Last question.
So I have kind of a sociology. So I love your idea. Do you think we can kind of prevent damage?
Yeah, let's take it to you, Professor Park.
Yeah, I think it's possible. I think it's possible. I think it depends on how we think and what policies we make. For example, in my environmental sociology class, we talk about consumption, and it depends on what we consume and how we consume. So, for example, Americans consume more than 30 times as much as some African people in Africa.
Yep.
So we are pretty much responsible for the global pollution, right? But at the same time, we can make drastic changes. So, for example, at UCF, we don't make paper catalogs anymore. We put things online, and we still consume, right? We still consume a lot. We can scroll up and down a lot, but we can consume knowledge, but we don't necessarily create stuff, right? They will actually go to the landfill. So I think if we develop ideas, then I think we can still don't sacrifice our life a lot, but at the same time, we can achieve a lot. So I think it's possible.
Great. Well, I know we're out of time. I don't want Abby to rush us off the stage. So I wanted to thank all of our speakers. Thank you so much. Thank you again to Volo Foundation.
Thank you,
Round of
Volo.
applause. Wonderful.